it's an extraordinarily complex piece of legislation and piece of implementation. So whenever there's complexity, there's opportunity for fraud. And a couple of areas I'd like to highlight this morning. One is sometimes some companies will imply or even state that they're part of the government. They're part of the Department of Human Services, or they're part of Social Security or Medicare or Medicaid, and then use that as sort of an ability to have some credibility and some entree to people. People need to be very careful about their assumptions and their beliefs that people are part of the government when it's not entirely clear and part of the context where you would be dealing with the government. A while back, about 2 months ago, we had some radio ads that were selling a healthcare product with implications that they were part of the government. We've been able to sort of shut that down in Iowa and are still looking at whether we should file an action or not. And then more recently, last Friday, we had another report that we're investigating this week concerning the same sort of thing, that a private company implying or suggesting that they are part of the government. Another area where we've started to see a little problem and want to warn people in particular is companies that are selling healthcare products and are telling people that they are qualified plans under the Affordable Care Act when they're not. And that's of some real significance because if they're not qualified and you buy it, you still have to pay the penalty. And also those that aren't qualified tend to be programs that are pretty thin, the coverage not very robust at all. So you may be getting a lot less than you think. One particular area that we've experienced over the years is in the area of discount healthcare plans. Basically, they provide some discounts for your hospital and other medical services and payments, and suggest that it's a health care plan. It's not. It's such a small factor in dealing with your bills that it certainly doesn't qualify as a health care plan. Another area that we're concerned about in this context is seeking personal information from people. By people that will be scammers and maybe identity thieves. If someone calls you and wants your Social Security number, your checking account number, in this context, don't give it to them. If the government is doing sort of a follow-up call of one type or another, they have this information. There's no need to give this out. State Representative Deb Berry and I were talking earlier. She's part of the help for the implementation here. She's one of the certified application counselors out of Allen Hospital. That there's a system of helping people through this extraordinarily complex area. There's a group of navigators. There were three navigators selected by the federal government. They are Genesis Healthcare, the Visiting Nurses Association of Iowa, and Planned Parenthood of the Heartland. And they're reaching out and available to help and counsel people. And to supplement them, there's the role that Deb is playing, the certified application counselors. And they are tied largely to the providers of healthcare in our state, like Allen Hospital. And it makes a lot of sense because they have a lot of contact with people that are seeking coverage. They're in the area, and also, if people come in and aren't covered, they can help them get covered for the future.